Hey everyone, this is my sickle cell anemia case presentation. A 1-year-old African American female presents to the ER with a 2-day history of GI illness, vomiting, and diarrhea. However, she appears to be in severe pain per Flack scale. Her hands and feet have notable swelling, and she moves them away when the clinician tries to assess them. Her eyes are also mildly jaundiced. The clinician orders a CBC with differential, reticulocyte level, and liver function tests. Her blood workup is significant for an RBC count of 2.5, hemoglobin of 7.5, hematocrit of 25, and a reticulocyte level of 3. Her clinical presentation, evidence of anemia, and reticulocytosis promote the clinician to send a hemoglobin S test or Sickle Dex test, which comes back positive. The patient is diagnosed with sickle cell anemia and is currently suffering a sickle cell crisis in the setting of dehydration due to GI illness. Her parents were unaware that they both carry a sickle cell trait, as neither have sickle cell anemia, so no prenatal testing was done. An IV is started and the patient receives IV fluids and 0.1 milligram per kilogram of morphine every 2 to 4 hours for pain until there are obvious signs of comfort. The clinician puts in an order for a chest x-ray to rule out acute chest syndrome. She is admitted for further treatment, including initiation of hydroxyurea to prevent further crises and a bone marrow transplant workup.